Today I'm going to be covering kinesiology and how we're going to use Kinesio tape in the clinic. Some quick starters. Remember that Kinesio tape comes at a 10% tension when on the paper. In the clinical setting, we can use this for burns, scars, bruises, spasticity, weak muscles. That variation of tension is going to change based on your application. Like for a bruise, it'll probably only be 10%. And for a weak muscle, you might want to go all the way up to 75% depending on the strength. Some quick tips before doing an application: you want to make sure that your area is clean. Now, I'm not a very hairy guy, but I do have some, so you would want to trim this away. Make sure that the tape has full contact with the skin. Clean away any dirt, oil. So using an alcohol-based substance, very common in the clinic, is biofreeze, and is not a contraindication to use with Kinesio tape. Actually would be a dual purpose and provide a cooling effect, which would aid the Kinesio tape effect. Don't want to use this over any open wounds, so if you are going to use it for a burn, make sure that it's in the late healing phases. But it'll prevent any contractures, help prevent any contractures. And then one contraindication is heat. Since we are creating vasodilation with Kinesio tape, thermotherapy would be too much reaction for some patients, so maybe want to avoid that. Some quick tips before application is to round off your edges. It prevents premature pull away and increases application time. So you just fold it over real quick and make a quick cut, and that way you get a nice round edge. Make sure to do that on both ends. And then you can start tearing down the back side of the paper, and you make yourself a nice little tab so you don't have to put your fingers on the tape. So just to show you, we have a little bit of stretch there. It's very readily available. You can get it in almost any sports store, Dick's Sporting Goods, ordered online, 16 feet for $15. They come in pre-cut muscle groups, or let's use the wrist extensors for an example. You can design your own tape structure, and from insertion to origin, or origin to insertion, I can attack all wrist extensors at the same time, superficial wrist extensors. Make sure that when you are applying it, that your joints are at fully flexed position, so you don't have any premature pull away from the ends. No tension, not any extra tension on the tape. And when we're applying it from origin to insertion, remember, origination to insertion is facilitation because the tension pulls in the opposite direction. And then from insertion to origin is inhibition. So eyes go together, and origination and facilitation go together. So I have this pre-cut prior, and I'm just going to give you a quick application. You want to create your tab, start to pull away the backing. Make sure that the ends are applied with no tension. So the Kinesio tape comes at a 10% tension off the roll. Rub it in for increased application, and then you can start to pull the tape back at different tensions. And I'm not using anything specific, just to show you. Now that I'm down where it splits, I'll do one at a time. This one down to the pinky. This is perfect because doing it by yourself, first time, you're gonna get tiny little folds, and that's fine. You just pinch those together. Make sure that there's no gaps. There's no airspace. And then when you're ready to pull it off, you just roll the tape off. Comes off pretty easily. This tape can be worn as long as the patient wants to. or until it starts to get itchy or irritated. But if the ends do start to pull away, educate your patient to go ahead and roll the tape off. This is easy enough and available enough that you can make this part of patient education and home exercise program. Let them take a video while you're teaching them how to do it in the clinic, and send them home with the skills able to do this themselves. Make sure that you want to do this, especially for an athlete, 30 minutes prior to a sports game. But if you're using this in the clinic, you can put this on at the beginning of treatment before your warm-up, or right at the end, right when you put on a cold pack before you send them home, and you get to kill two birds with one stone there. That's it. Thank you.